Yo. Okay. I told you. Powerful, profound women. Guys, let's give them it's Q&A now. Does anyone have questions? Questions? Number one. Okay, number one. Number two at the back. Yeah. Number three, number four. Yes.
Thank you for great arguments on both sides of the fence here. But Nadia, I want to sort of just pose to you that one of the difficulties I encounter is that when people are struggling with their very survival, with existence, trying to make ends meet, get to where they need to be, or indeed just dealing with day-to-day stuff, you've got to do something to get their attention, right? And so is there a place for grabbing somebody's attention with a reasonable cash transfer, not a large sum of money, but at least something of value that gets young people's attention? We've spoken today, I've heard the comments about present bias, how it's hard to be focused on something. Can it be used to get focus and then intervene with other prevention methodologies? So just want to put that out there.
Yes, so my response to that is yes. The thing is, so my argument is from the standpoint of really the money should be an enabler for a different means to the end of reduced HIV incidence and not the core strategy. And I think that's how we are looking at it differently. So for instance, I might give a conditional cash transfer to get someone's attention, to get a young person's attention, but really what they need is peer support. What it is mental health interventions. What they need is actually engaging their family, if there's stigma issues, all of that, to reduce their incidence of HIV. So a lot of times as a pediatrician, I might see a young person in clinic and realize that what this person might be suffering from or what is bothering them overall in life is poor parenting or poor support at home. When you have people who are well adjusted, these issues are easier to address. So for example, mental health issues. You can give, and money is the root of a lot of depression and mental health issues. But if the person has an organic mental health problem, you give them funding, it does not fix the mental health issue. But then they can get to the clinic to actually see a professional who can give them counseling and who can provide medication to support their mental health issues. Thank you.
Thank you. We have one more question at the back.
Thank you so much. My name is Paramani Moyo, working with PATA. I'm not going to support any of the debaters with my contribution, but I would like to say, some are saying I'm too short, they can't see me. But I would like to say, as much as we are trying to address HIV transmissions, I am not disagreeing and I'm not agreeing with you that cash injections will help. But I would like to say the question that we should ask ourselves is, where is that money coming from? We have ministries of health, for example, but yet we do not track the monies that they are being given by the government. For example, in Zimbabwe, my minister always say, there is this fancy word that he uses to say we have excess or something like that, which says we have a certain money that is left out. But my question is, Ministry of Health, or should I say a department from health, is given 5 billion, and then at the end of the day they get 2 billion, they didn't get 5 billion, which means 3 billion is still left in the government. What are we doing with that money? How are we tracking those funds as civic society? Because as much as we can continue going after donors to say they have to give us money to give young people or adolescent cash injections, it does not help. And also think about capacity building. Think about economic empowerment programs for young people. Because besides me accessing free HIV services, I have economic issues. I need to have source of income. It's not enough giving me that 300 rand or 400 rand. It's not even enough because I have other problems that will make me to go back and sell sex. Just because that money that you gave me is not enough. So my recommendation would be, let's consider economic empowerment programs for these young people. Thank you.
Yeah. Sorry.
Thank you very much. Can you guys hear me? Okay, thank you. Thank you very much for your deliberations. I'm going to keep my questions short and simple like myself. So it's directed to Tracey. My question is, you know, we're looking at the pregnancies, before HIV, the pregnancies, STIs, and also the increased numbers of HIV new infections, and I'm going to base this in South Africa. There was a trend whereby most young women fell pregnant so that they can get social services or the social grant money. So now, when we're looking at the disadvantaged communities whereby they don't have money to buy bread or anything, don't you think that it will increase the numbers of new HIV infections if we put cash injections? Looking at how adolescents and young people most of the time think that, you know, if I get infected, and there's also a trend that's happening on social media that most young people right now are afraid of pregnancies rather than getting HIV, you know. So won't it decrease the numbers and also put a strain on the government, because already we have issues when it comes to budgeting for ARVs. Most people are not having access. Most young people cannot go to the clinic to access those ARVs. So wouldn't it increase the numbers by putting in the cash injection? Wouldn't it put a strain also on the government, as one of the participants mentioned that the government is receiving a lot of money, but some of it's not directed to the right departments? Thank you.
Very much, my sister. And, you know, that's a folklore, actually. Like, it's a myth that cash transfers make people want to get pregnant. The evidence actually shows that people who receive cash transfers, what actually happens is that they increase the birth spacing. So instead of having children too close together, it increases the birth spacing. Do we have a problem of teenage pregnancy in the country? Yes. But the issue is that the teenage pregnancy in the group that receives the cash transfer is not any higher than in the group that does not. And the cash transfer is not conditional on HIV. So the cash transfer, as I said, you get it just from a socioeconomic perspective. If you earn below a certain amount of money in the unconditional cash transfer, but you get that one. If I can just comment that the cash transfer, what it does, it actually is what Linda Gale was saying. It locks and grabs the attention of young women. Because if you think young women have other things, there are opportunity costs. In my own study, as you heard my sister here told you that I'm doing my PhD. In my own study, what we did is that we gave young women 300 rand for them to come to the intervention, which was an HIV prevention intervention, and we checked and saw if we didn't give them what would happen. If we gave them the cash transfer, they came 60 times more than if we didn't give them. And it's not because they didn't believe that what we were offering was not good enough. They had other things to do. When I spoke to them, they said they've got children to look after. They have to go and look by a faller. They have to go look for jobs. So if you want me to come and sit for 90 minutes listening to a very important behavior change intervention, which my sister is talking about here, or to go to a health service, it's an opportunity cost for me. Poor people have very difficult choices to make. Do I go and do something that I know in the long term is going to be good for me? Or do I go and look for money? It's a very hard choice to make. So the argument that I'm making is that give that 300 rand, and it's not going to replace your sugar daddy. No, but it gives you options. And the research shows that young women who get cash transfers, they do make different choices in terms of their male partners. And sister, it's not just research studies that we're talking about. We're talking about big, large, national level interventions.
In South Africa.
No. In Southern Africa, there's quite a high prevalence of unconditional cash transfers. It's not just South Africa. South Africa has 11 million people that get cash transfers every year. But we've got other settings in Mexico, in Brazil. So we're not talking just about
All
research
upper middle countries. Upper middle.
No, but definitely Southern Africa, remember where the biggest burden is, and from a cost effectiveness perspective, we go to where the biggest bang for buck will be, and that is in Southern Africa. Amen.
Thank you. Hey, yeah, it got heated in there. Couldn't even jab in. I'm so sorry to everybody who has questions. We unfortunately have run out of time, but they will still be here right after the rebuttal session and right after we voted. I'm so sorry, hey. It wasn't me. It wasn't me. We are gonna start the rebuttal session, which you have started, don't worry.
Can I have my slide?
It's a minute, hey? I'm just saying.
It's a minute.
A minute.
Okay, I won't use my slides. So the point that I'm making is that we want to go for the biggest bang for buck. The biggest bang for buck is in Southern and Eastern Africa, and particularly Southern Africa. We're talking about not cash transfers for everybody, cash transfers so where they are needed, where they will make the most difference, which is adolescent girls and young women in Southern Africa from poor families with the highest risk. We are talking about cash transfers. Yes, I agree with you, my sister. They are an enabler, but they are an enabler so that you can do the things that you need to do. We will bring them into you with the money so that you can give them the health services, so that we'll give you the money so that they can eat and be healthy and be full, so that when you give them the ARVs, they don't say, no, it makes me more hungry, so I'm not going to take my ARVs. Thank you.
So, I want to say that when you are talking about these programs in a setting of poverty, what we are not seeing, right? We are having this argument about here. Do you hear a lot of that in countries that are higher income or countries that have better governance? I'm talking about systems where if you have good governance, you have universal health care, you have stable systems, you have less conflict, you have systems in which people are existing in a way that they don't have to worry about their health to that extent, where you have to give them individual cash transfers. So what I'm saying here is that let's think big, that no matter how many cash transfers you are given in South Africa, Southern Africa, you can tell me that you can see that good governance, good structures, structural strengthening, health system strengthening will actually do much more comprehensively and sustainably than individual cash transfers. And so I'm telling you, I'm not saying the money shouldn't be there or budgeted, but it can be put directly into the health services that these people need. Universal health services. Adolescent responsive healthcare, not friendly. I don't like using the word friend. Adolescent responsive healthcare. And you will see that your impact and the bang for your buck will be much better, not only in Southern Africa, but the entire world. Thank you.
Can everybody take out their phones, please?
You can't vote for yourself.
Can we vote for ourselves?
Yeah. You can either enter the code or scan the QR code. Can I vote?
I can't even see it.
It's open.
Click disagree, people. Disagree.
Agree. Yes, yes, agree. The first one. The first one. Oh!
What?
Okay, we're gonna close it in the next 30 seconds.
No, agree. Vote.
10.
As I said, you cannot cook yam with your anger.
Is everybody? Three, two, one. Well done. Well done.
Oh no, the question is. Without cash
Okay, that's
transfers-
for another day. That's for another day.
Without cash transfers preventing HIV.
Repeat the vote.
They understood it.
Sorry. I don't know how it works here, but in council, not everybody speaks at the same time. Not everybody speaks at the same time in council. Sorry. So, sorry, we're not going to re-vote. If you didn't read the question properly and didn't listen to the debates, sorry. It's not good. We don't have time, unfortunately. But well done. I think both arguments went well. Thank you guys for once again for coming for the whole day. Please don't forget to put on your ideas on the poem and how it should end. From my side, thank you. It was a privilege standing here today and working with each and every person. Thank you.
Great. Everyone, before you go, I also just want to thank again our mayor and for a beautiful moderation and, of course, the debaters. Well done, guys. I think you both won. I think the point of these debates are really that we hear both sides of the argument, and I think and we carefully choose things that aren't necessarily cut and dried, right? So the idea is hopefully you will continue these conversations now as we go down for our cocktail hour and on to the dinner. So let me first say that you are all welcome to come to the welcome reception, and also just to remind you that we'll be doing our launch of Africa Reach, so we'd love to have you there, and we have a special artist coming, so surprise, so do go down immediately after this downstairs. Just to remind you also, we have the marketplace and we have the poster walk, so that's also to be done, all of us, before we think about dinner. Now, if you registered online for dinner, please, you are welcome. You should have a ticket on the back of your ticket if that was captured and you are registered. If you have decided, oh my, I didn't realize and I now want to go to dinner, you've got to speak to Karen, Magda, or Rika, or maybe the volunteers as well, or is it just the three of you? The three ladies from Virology, to see if there are still spaces for you at the restaurant, okay? Just to say that sponsors, that if you aren't sure whether you are or not, come and check with the staff, okay? Otherwise, the buses will be leaving by 7:10. If you're not there, I'm afraid we will go and you will need to Uber, because that's the only way you're going to be able to go there, all right? Okay. Otherwise, we will be back here again tomorrow morning at 8:30, and again, we have another full day. So come fully charged with cups of coffee and ready for another good day of programming. Are there any concerns or questions anybody wants to raise at this moment? If not, we will see you downstairs shortly for the cocktail hour. Thanks so much, everyone.